Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a July 13th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County added 26 new COVID-19 cases since yesterday, 127 since my report on Friday, July 10th. As of Monday, July 13th at 2 p.m., Dubuque County has 989 positive COVID-19 cases. Sadly, one additional death occurred over the weekend, so a total of 23 deaths have occurred in Dubuque County. About 6.5% of the over 15,000 people tested in Dubuque County have been positive. For those Dubuque County residents getting tested for antibodies to COVID-19, about 5% are positive. 6 individuals are currently hospitalized, and about 44% of Dubuque County cases have recovered to date. Friday, I reported how the 18 to 40-year-old age group is dramatically increasing in the amount of positive COVID-19 cases the past few weeks. We are now at 55% of the cases reported being in the 18 to 40-year-old age group. On June 26th, that number was just 41%. The state added 459 cases since yesterday. As of July 13th, 2020 at 2 p.m., Iowa has a total of 35,529 positive cases. In all, about 1 in 8 Iowans, or over 377,000 people, have been tested. About 9% of Iowans tested have been positive. Deaths reported in the state total 754 Iowans. Currently, 177 cases are hospitalized, with 30 patients being admitted to the hospital in the last 24 hours. And finally, about 75% of Iowans have recovered. Friday, I did an extensive review of isolation and quarantine requirements. This stuff is not easy, and I certainly did not go over all of the possible exposure, isolation, and quarantine situations there are out there. So it may be worth rewatching that explanation, but in the meantime, I want to review one part that we continue to receive questions on, and that is the quarantine requirements. Quarantine is what you do when you're exposed to someone who tested positive or who has symptoms of COVID-19. You may unknowingly expose yourself to a positive case who is not exhibiting symptoms or only has mild symptoms that are not obvious. In other words, quarantine is used to keep someone who may have been exposed to COVID-19 away from others. Quarantine helps prevent the spread of disease that can occur before a person knows they are sick or if they are infected with the virus without feeling symptoms. People in quarantine should stay home, separate themselves from others, and monitor their health. Exposed people have to quarantine for 14 days. So where does the 14 days come in? That is what we refer to as the incubation period, the range of time it can take for symptoms to develop and/or a positive test to show up after you've been exposed. The incubation period for COVID-19 is 2 to 14 days, meaning if you have an exposure, it won't show up on a test for 2 days, but it could take as long as 14 days. So if you get a test during this 14-day period and it's negative, you still may show up positive later. That's why you cannot test your way out of quarantine. Here's your exposure. Here's your 14 days. Here's when you're not having to follow exposure anymore, regardless of any test result. Last week I read an editorial by David Lenenhart in the New York Times. He discussed what it may be like in the future, say the year 2022 and out. After we've been dealing with this pandemic for longer than any of us have ever imagined. We know almost all aspects of our life have been modified by COVID-19. Work, school, socializing, travel, healthcare, finances, etc. But how long will these changes, good or bad, last? Because he said it so well, I'm going to quote the author, David Lenenhart. Many things will not change. That's one of history's lessons. The financial crisis of 2007 through 2009 didn't cause an American to sour on stocks, and it didn't lead to an overhaul of Wall Street. The election of the first black president didn't usher in an era of racial reconciliation. The 9/11 attacks didn't make Americans unwilling to fly. The Vietnam War didn't bring an end to extended foreign affairs without a clear mission. Yet if the pandemic really does shape life for the next year, it will probably be remembered as a more significant historical event than those precedents. It could easily be the most important global experience since World War II and the Great Depression. Events that hold the world's attention for long stretches and that alter the rhythms of everyday life do tend to leave a legacy." End quote. How many of the public health measures you've been practicing will you continue after post-pandemic? I would hope hand washing, covering your coughs and sneezes, and not going out or to work or school when you're ill would stick, considering we've all been supposed to be doing these things anyway, even pre-COVID-19. Now, we not only have a better understanding of the reasons behind these basic sanitation and separation requirements, we've lived them, and they should have a lasting effect throughout our lives. Kind of like people who lived through the Depression became savers for life. So as we begin the week, continue to watch for COVID-19 symptoms in yourself and your family members. Depending on your circumstances, you can get tested through your healthcare provider, local hospital, or clinic, and the Test Iowa Clinic will continue this week at Epic Health and Wellness, 1075 Cedar Cross Road. They'll be open Monday through Thursday, 5 a.m. to 9 a.m., and all you have to do is take the assessment at testiowa.gov and have your code and Iowa ID ready when you arrive at the test site. In fact, you can go to any Test Iowa site in the state. Thanks for tuning in today. Let's all be safe and practice proper public health measures. Let's not put ourselves in unsafe COVID-19 situations because remember, we're all in this together.